my name's Karen. I'm the care coordinator at the Lauderdale practice in Woodley. I've been there now just coming up 4 years. This is working, is it? So I've been there coming up 4 years in December, and I do the cancer care plans along with a few other things. I look after dementia, so I do the dementia annual reviews. I also look after palliative care and a few other things. So basically, with the personalised care reviews, I have the first contact in the first 3 months of diagnosis. And as Dr. Purcell was saying earlier, it's finding the right balance and finding the right time to get in touch, because they're going through a lot of things when they first get their diagnosis. And I found that probably around 4 weeks of getting our initial letter from the hospital is the best time to contact them. By then, they've usually had their first appointment with oncology and have some idea of their treatment plan, but still maybe waiting some results from CT scans, etc. But they have an idea of what's happening and what's, their diagnosis. So I code the cancer care plan for the 3 months and the 6 months. I offer them future appointments to support them through their journey, and it depends on the individual. So when I first make contact with them, I listen to what they have to say and where they are on their journey, and I offer to follow them through their journey. It depends on what they're going through, what their cancer is and what their needs are. But I will always diarise to follow up with them. Sometimes it could be 2 weeks, 4 weeks, it could be 6, it could be 8. But it just depends on that individual. But I make them aware that I'm there for them should they need to talk about anything, if they have any worries or concerns. And I try to help in the way that if, rather than, when they start their treatment, their chemotherapy, radiotherapy, or surgery, whatever they're going through, that they don't have to think about getting up at 8 o'clock in the morning and calling the practice and waiting for you or waiting for a call back. They can call me directly. I'm there full time, Monday to Friday, so they can call me directly, and I will then support them, whether it be, for instance, they could have started, they're going through radiotherapy treatment, they've got a rash, they're really itchy, they don't know what to do, then I can send a task to the GP and just, ask for their advice really. And if the GP usually comes back to me quite quickly, and if they feel they need an appointment, then I can go down to reception and book that in for them. Or if they're housebound, we can arrange for a district nurse to go out to them, I can do referrals for them. So it's supporting them through their journey, whatever their need may be. And even when they finish their treatment, if they still want those follow-up calls, then I'm quite happy to do that. I log all of this on a spreadsheet, like Joyce was saying. So when I get the first initial letter, I will log that, and then I kind of plan how I'm going to contact people from there. So usually I contact them by telephone first, and I will offer them, we can either discuss their cancer care plan over the phone, or I will offer them a face-to-face. And I will do, I'm quite happy to do a home visit, or that could be here at the practice. They're coded. Initially, how I first am made aware of a cancer diagnosis is through our admin team, the code. They will then send a task to me to say, new cancer patient. So I'll go into document and I pull the letter, print it off, and then that's how I log it and move forward with that. So when I call a patient, obviously I just say that we've received a notification that you've had a recent diagnosis, and then let them talk and listen and go through that. Any concerns then obviously are escalated. And I can signpost to other services if necessary. For instance, if they've got social issues, if they're a carer for somebody, and they need that additional support, or otherwise. Right. So I'm just going to go through a case study. So this is one that's ongoing at the moment. It's a 69-year-old lady who was diagnosed with breast cancer. I actually knew this lady already because, as I mentioned earlier, I also look after the annual reviews for dementia, and her husband was diagnosed with early onset dementia 5 years previously. So I see her annually anyway, and she had been struggling over the last probably couple of years with her husband, whose disease progression had made things quite difficult socially at home. Unfortunately, earlier this year, in January, actually, she was diagnosed with breast cancer. It was quite a shock for her. It was actually one of her worst nightmares. Her mum had dementia, so her husband getting dementia was awful in itself. Her mum also had breast cancer years ago and had a double mastectomy and suffered with mental health and never got over it. So all of her worst nightmares were coming true. So she reached out to me the day she got the diagnosis. Actually, she called me even before she'd seen her GP and said, "Oh, you'll never believe, I've had a diagnosis of breast cancer. I just don't know when to turn. I don't know how I'm going to look after my husband, and I just can't deal with it." So obviously, thankfully, we already had a relationship. I made arrangements to go out and visit her straight away. So she wasn't a normal case. Normally I would just log it, wait for 4 weeks, contact her. So straight away I went out to visit, and was there to try and support her. Fortunately, she started a treatment, so it was going to be chemotherapy first with cold cat treatment, and then she was going to have surgery and radiotherapy. And she knew it was going to be a 12-month process, so she knew it was going to be an ongoing thing. And she just didn't want oncology to tell her too much about what was happening. She just wanted to get on with it and go through it. Her husband at this time really struggled with changes that were happening at home. Obviously she was going to appointments every day, starting having her PICC line fitted, and then obviously her chemotherapy was daily, 5 days a week. Her daughter was coming down from Essex to stay to help look after her husband, and he just didn't know what was going on. He was getting very confused. Unfortunately, the cold cat treatment didn't work very quickly. She started losing her hair, which was another one of her worst nightmares. She one day started was so unwell. Chemotherapy made her extremely sick. She just was extremely unwell with everything that could hit her, really. And one day her husband was playing up downstairs, and she came downstairs and forgot to put her wig on or her headscarf. And her husband looked at her and said, "What have you done to your hair? It looks a mess. You need to sort it out," which I thought was quite funny, looking at the funny side of it. But from there, he really, really deteriorated. He started smearing feces all around the house, throwing everything on his bed, urinating over it, and obviously she, unfortunately, got an infection. Was really unwell, and she was told by a clinical nurse specialist that she wouldn't get through a treatment, if this continued, that she just couldn't carry on the way she was. Throughout this time, I was liaising between the lady that I had built this relationship with, and obviously her husband. Her daughter, her sister, was involved as well. She was coming up at weekends from Cornwall to help care for Terry, which is his name, which I shouldn't say really. So to help care for him, and so her daughter could have some respite and go back to Essex to be with her family. But it just wasn't working. So I was involved with social services. Safeguarding then had to be made, because he became very, carers were put in place to help support him, and they were going around there daily 3 or 4 times a day. But he became very possessive of his carers and didn't want her in the same room as them, or to look at them, or to talk to them, because they were his. And it got to the stage where he was pushing her and hit her. So he had to be removed, and unfortunately had to go into full-time care. where he went a couple of weeks ago and where he is now. Much to the family's distress. They are trying to find the right placement for him. So I just wanted to share this with you because it shows that, you know, obviously I had to know where my limitations were. Yes, I could do the care plan, and I could refer to the GP, I could refer to adult social services, but when the safeguarding became apparent, etc., then it's working as a team. So it's not only working within the practice with our clinicians, it's also working with council, you know, adult social services, our hub in Wokingham, the cancer nurse, and the specialist, the social workers and everything else. And I just thought it was really important to, you know, it all kind of merges into one, but we need to know where we can go with it and how to move on. That's everything. Does anyone have any questions?